And what unit do you work in?
Yeah. It's Tiffany Dover, TIFFANY
And what unit do you work in?
CCU.
So I guess just talk to us a little bit about what just happened after passing out after taking the vaccine.
Okay, so I had a syncopal episode. I have a history of having an overactive vagal response. And so with that, if I have pain from anything, hangnail, or if I stub my toe, I can just pass out. So what happened is I get an aura before of feeling weak, dizzy, disoriented, and it just, hit me all of a sudden. Just felt really diaphoretic, and I could feel it coming on, so I felt a little disoriented. But I feel fine now, and the pain in my arm is very minimal, actually, but it doesn't take much.
So you feel fine now?
I feel fine now, and this is, I have passed out probably 6 times in the past 6 weeks. It's common for me.
Okay.
Yeah.
No regret taking the vaccine?
No, no. I mean, like I said, a hangnail can cause me to have this.
So this is common?
It is for
your
me,
health?
yes.
Okay.
Yes. Typically, like I said, I can feel it coming on, and I could, but I was trying to push through, but,
Thank you.
Okay.
Thanks for talking.
Well, yeah, thank you
to
so
us.
much. I appreciate it.
Around to be monitored for a few minutes. One of those is in case you have an allergic reaction that's exceptionally rare with any vaccine, but theoretically possible, so we recommend being on the safe side with that. If people have a history of having hypersensitivity reactions, not of an allergic nature, but getting nervous or getting a little bit lightheaded after a painful stimulus, sometimes just sitting down for 10 minutes before getting back up is advisable, and can prevent this kind of thing from happening, because translating the blood pressure can just lower a little bit, basically just from an increased vagal tone to the nervous system.
So what do you think was the case here?
I think that she got a shot in the arm and made her feel a little bit lightheaded, and she's recovered now. It's happened before, apparently.
Okay, so this is normal behavior for this person?
It is a reaction that can happen very frequently with any vaccine, with a shot of any kind.
There's no reason to be concerned with the vaccine?
Kind of like if you've been to the doctor and had blood work done before, some people get a little lightheaded when they see the needle going into their skin. This is the identical kind of reaction. Yeah, no reason to suspect that that's due to the vaccine whatsoever. But if you're afraid of needles or have a history of getting a little bit worked up or sensitive around needles, take a minute afterwards and catch your breath.
All right.
If that did happen to somebody, like, what's the protocol? Like, if you are getting lightheaded, what do you do? Like, sit down, put your...
Sit down, have somebody fan you a little bit, take a drink of water. For people who have diabetes and are on insulin or have a predisposition to getting low blood sugar, having a little bit of glucose in the form of a cookie or a cracker or something can help too, because sometimes hypoglycemia can present this way as well. But just sitting down and taking a minute before going about your day.